Greetings. This is Christopher Roby, the Chief Operating Officer with the Community Health Centers Association of Mississippi, and I'm joined today with my good friend David Selig. Dave, introduce yourself and your agency you're with.
Hi, everybody. My name is David Selig. I'm the owner and principal of ForgeWorks Consulting Incorporated. It's a small solo consulting practice focused on federally qualified health centers, working primarily in governance and leadership, executive leadership. I also do a little bit of interim CEO work. Right now I'm the interim CEO of a large health center agency in New Jersey, and really just been enjoying working with health centers since I started in 1997.
Awesome. So Dave, with your extensive background, let me ask you a couple of questions. So when you think about the future of health centers, what opportunities or challenges do you believe we must address today to ensure stronger, healthier communities tomorrow?
Right now we're in a very interesting environment where there's a lot of pressure on health centers, especially from all sorts of directions. The federal government is really changing its approach to how health centers are being treated, although there continues to be bipartisan support, generally speaking, in the federal government, but the specific programs that are important to us as FQHCs and lookalikes are under a lot of pressure. So I think one of the biggest challenges right now is we just don't know what's coming next. And so for us as a health center agency, what we're trying to do, and I think what's important to be done, is to focus on the things that you can control within your organization. Make sure that those operations, your finances, that you are as solid as you can possibly be. And that will help weather, continued storms. We're going to get more and more changes. We know that.
Yeah. Do you think that health centers need to focus on diversifying their funding sources?
Absolutely. One of my first experiences with FQHCs was in 1997 when I was recruited by the Virginia Primary Care Association to start the statewide network. And we had no funding other than one grant. And, when I looked at the financials and our revenue sources, it was 100% the health center controlled network funding. That, to me, was something I needed to focus on right away. When I left, I was there for 15 years. When I left, our federal funding represented only 16% of our funding. So we spent the time to build the services and the programs for the members, but it was important for us to diversify those revenues.
That's awesome. The conference theme this year is strengthening our roots, getting back to what we've done traditionally for health centers. So what has been the most valuable lesson you've learned during the conference since you've been here, and how are you going to take that back as you're in your interim role you're in now and apply some of those things?
Sure. Well, one of the things that really strikes me about the conference last year, I look at the conference from last year, this year, it just gets better and better. And for me, it's you can't be at all of the programs and hear all of the speakers. The quality of the speakers have been great, and that the information, you might not be able to take 100% of the information that is presented at a particular session for whatever reason, but if you're able to take back a couple of nuggets, that's what's really important. So trying to do that with all the sessions I'm at.
Awesome, glad to hear that. And so this year's conference, I think our attendance is up to 388 people thus far. It's probably one of our largest conferences. And so what has been the networking opportunity for you at the conference this year?
Well, it's wonderful. For me, I have a personal liking with Mississippi. I was here from 2018 to about 2020, 2021, helping to get Mississippi Health SafeNet up and running. We did a good job with that, but I became really close colleagues with most everybody, the PCA staff, all of the health centers that were in SafeNet. It wasn't all of them, but was able to develop more relationships outside of SafeNet as well. So for me, it's coming home.
Yeah. Since you brought up SafeNet and the HCCN, many people don't understand there's a difference between the Primary Care Association funding and then the HCCN funding. Can you just break that down just a little bit for us?
Sure. The Health Center Controlled Network funding actually began in 1995, around 1995. And the purpose at the time, and still is, to fund collaborations among health centers for specific purposes. The early funding was for either providing services to the health centers, the members, to reduce their expenses or to increase their revenues, and then eventually quality was added. So the network funding had three purposes. The Primary Care Association funding had already been set, and of course in the early years, you can imagine, there was a lot of confusion between what should the primary care associations be doing versus the networks. And so it took a while to get that worked out. Right now, the funding is specific for working with providers, working on quality. A lot of it is based on the use of electronic health records. In the early years, when Virginia got some early funding, we received network funding to actually purchase the electronic medical record software for everybody. And so you can see how the funding has kind of changed. The funding from the primary care associations is still to continue to support the networks, to support the members, and to provide those services as well. For me, what's important is, and I've spent some time doing this, is really when the network is a separately funded entity to work together with the primary care association to work on common goals.
One of the things that people most often remember is the meaningful use funding. Was that the prerequisite for HCCN, or it kind of built into what we now know as the HCCN?
Yeah, the meaningful use expectations and those dollars came about at the time when the networks were still growing. And when those programs became available, a lot of networks saw that as being something that they could be participate in. So I think it was more after the fact, and it was more of a parallel activity that happened while the networks were growing, and it seemed to be a good fit for networks to work in that space.
Well, again, David, thank you so much for taking some time out and presenting for us this year at our annual conference, and we always welcome you home to Mississippi.
Great, thanks a lot.
Thanks.